Good morning, everyone. I'm Purnima, member of IQAC and MAC Committee of Mahajana First Grade College. Quoting the words of famous author Mr. Deepak Chopra, every time you're tempted to react in the same old way, ask if you want to be a prisoner of the past or a pioneer of the future. With this positive note, I extend a warm welcome to all the participants across the nation to the one-day national level webinar on mental health and well-being facing the fallout during pandemic. Before we commence with the session, I request all the participants to adhere to the following instructions. Kindly mute the audio and video so that the speaker is not disturbed. The session is being conducted on Google Meet and will be live streaming on YouTube. Attendance is mandatory for all the participants. Login and logout timings of the participants will be monitored. Participants are requested to comprehend the questions in the chat box well in advance along with their name and details. Kindly do not prompt during the session. The participants will be given an opportunity to interact with the resource person only at the end of the session. Therefore, you are requested not to be in a haste while directing your questions. Kindly wait for your turn if you hear the other participants posing a question. Further, the interactive session will be monitored by the coordinator and the feasibility of time will be the deciding factor to limit the discussion. And to get e-certificates, participants are requested to fill in the feedback form. The link will be shared in the WhatsApp group immediately after the session. The audience of the webinar comprises students of UG and PG departments of psychology, academicians, mental health and HR professionals, research scholars, counselors, and coordinators of IQAC and NAC. With this information, may I now request our beloved in charge principal, Dr. Pushparani Madam, to speak a few words about the college and the objectives of today's program. Over to you, ma'am.
Very good morning, everyone. I extend a hearty welcome to all of you to this national level webinar hosted by the Department of Psychology along with IQAC on the topic mental health and well-being facing the fallout during pandemic. On this occasion, I am glad to share a few words about our college. SBRR Mahajana First Grade College has been continually striving for the holistic development of the students in its journey of 37 years. In the year 1999, it established the Postgraduate Center. With 34 departments under its umbrella, the college has been active in the field of higher education. The college has raised its bar by successfully facing contemporary challenges in the field of higher education while consciously dedicating itself to construct a healthy society. The college has to its credit of being the first institution among the affiliated colleges of University of Mysore to be accredited by NAC with 4 stars in the year 2001. It was re-accredited in 2007 with B++ grade and A grade in the year 2015. In a survey conducted by Education World in April 2020, our college was recognized as the 16th best college in Karnataka and has obtained 77th ranking at the national level. Various platforms like NSS, NCC, sports, cultural, and many other ASIC fora in the college help students involve actively in co-curricular activities. These activities help them develop their overall personality by being creative and also enhance their self-capability. It is a matter of pride to mention that the college feels blessed with the visit of former President Dr. APJ Abdul Kalam, Nobel Prize winner Professor Mohammad Yunus, Salumaravati Makka, Jnanapita awardees, Professor U. Anantamurthy, Dr. Chandrasekhara Kambara, and a host of others. As a part of our continuous involvement with curricular as well as extracurricular activities, various departments are conducting webinars. This is the 13th webinar in the series scheduled by the college. The present pandemic is not an easy time for anyone, and now More than ever, we need to prioritize our mental health as well as well-being. Between the constant pressure we are under with the day-to-day life and worrying about the pandemic, we might be feeling stressed and anxious, with in turn make us unwell always. With the right tool, we can find a way of coping with the existing situation. In today's webinar, eminent speaker Dr. N. Manjula, Professor, Department of Clinical Psychology, National Institute of Mental Health and Neurosciences, NIMHANS, Bengaluru, will be discussing on the topic mental health and well-being facing fallout during pandemic. I hope that the participants will make the best use of this webinar. I congratulate the department and I thank the resource person who will be sharing her experience on the topic. I thank all the participants and wish the webinar a success. Thank you all.
Thank you, ma'am, for the brief introduction about the college and the objectives of the program. Now I request Madam Sujata, Head of the Department Psychology, to welcome and introduce the guest speaker, Professor Manjula, Department of Clinical Psychology, NIMHANS. Madam, please.
Mental health is as important as physical health. Endorsing the statement which has already been asserted by our beloved in charge principal, we are here today. Good morning, all. Quoting Dan Vaughan, it is important to find time for yourself and find clarity. The most important relationship is the one which you have with yourself. With this insightful thought, I would like to assert that this national webinar on mental health and well-being facing the fallout during pandemic is an humble effort of the Department of Psychology and SBRR Mahajana First Grade College, Mysore, to illuminate the prevailing upsurge in mental health challenges due to the pandemic as a mark of its values-based educational approach and as a mark of social responsibility. Our institution has taken up this initiative. I welcome you all and the resource person, Dr. Manjula. Welcome. Now, I take the opportunity to introduce our resource person, Dr. M. Manjula, Professor, Department of Clinical Psychology. Madam pursued her undergraduation BSc from Maharani Science College and MSc in Clinical Psychology from Bangalore University. While she achieves MPhil in Clinical Psychology from NIMHANS, Bangalore, and PhD from NIMHANS in 2003. Her association with psychology has been long. Her career takes off as a clinical psychologist in NIMHANS, and her association has been with research is incredible. Dr. Manjula has been associated with NIMHANS since 2002, and presently she is a senior professor in the Department of Clinical Psychology, NIMHANS, Bangalore. During these 2 decades of her professional journey, Dr. Manjula has accomplished herself as an established researcher with vivid interest in community-based interventions for mental health issues among the youth. And through her expertise in CBT, cognitive behavioral therapy, and third wave therapies, has helped several individuals in mental health issues to cope and move towards their truest potential. Ma'am, you are an asset to a society which is on mental health well-being. Highlighting Dr. Manjula's research contributions, she has guided 18 MPhil dissertations and 17 PhD theses. A few of them are ongoing. Presently, she is working on various national and international projects being funded by ICCR and ICMR. To quote a few: stress management, self-injurious behaviors, and psychopathology among adolescents, suicide prevention in youth, and awareness and stress coping based programs. Well, she has published 65 papers, presented 60 scientific papers, organized 150 workshops for people from different walks of life, and also published several books. I would like to share one experience of mine with Dr. Manjula Madam before I complete my introduction of our resource person. It was just few instances on which I had an opportunity to talk to her, and I asked her, I was spellbound by her achievements. And at this instance, my personal interaction with her, when I asked her, how come you have achieved so much, madam, in such a lesser span of time? To my surprise, she just smiled. And that made me realize her modesty and simplicity. Madam, I welcome you, and it is indeed an honor and a wonderful opportunity for all of us to get to listen to you on this platform. Thank you.
Thank you, Madam Sujata, for all those good words and very detailed introduction. And first of all, I would like to thank the Mahajana College, the principal, Madam Pushpa Rani, and Madam Purnima also, for giving me this opportunity. So I will start off with my presentation now. Yeah. I'm not sure if my screen is seen properly. Yeah, so I will start the slideshow. Yeah, so you can see, isn't it? Okay, so yeah, the topic is mental health and well-being and facing the fallout during the pandemic. So when I started making this presentation, I was keeping mostly the students in mind. But then Madam Sujata had told me also that maybe that there are other people who are attending, say HRs and that counselors and PhD scholars and all that. So I have little bit I have just gone into people who are in the working settings and the kinds of the difficulties that they face also. So first half of my presentation will be talking about the nature of the difficulties that people face, and the second half I will be talking about what can we do, that is like as individuals, what are the things that we can do. So because I'm not specifically talking about any specific group of individuals here. So each individual, what they can do basically. Yeah, like all of us know that like how difficult it is after facing this lockdown, isolation, quarantine. I'm sure that many of us, especially who work in the hospital settings, have undergone quarantine, and that because of various people getting tested within the hospital, and that people getting in contact with them. So it has become a very normal phenomenon now. And over the time, maybe from March onwards, we have realized that how difficult it is to be in isolation, to be isolated from people. So these are the three words that are causing a lot of difficulty in terms of the psychological stress that we face. So human beings are social animals basically, but then if they are cut off from the social contact or the interactions, how difficult it is. I think the first time that the whole world is facing such a pandemic, which is affecting all the nations across the world. So these three things basically have posed a lot of because of this, a lot of adverse consequences that we have faced. And it is not limited to any age group. It is across the age groups, and it is across the professions. So you name it. So all kinds of professions have got affected, and irrespective of the gender, and that people have been facing the stress because of the prevailing conditions now. So lockdown and this quarantine and all that comes with a lot of negative consequences with respect to the limitations that we have, in movement, as well as that you are earning, and that your physical and mental health, all that gets affected. So social isolation results in reduction in interpersonal contact, which has psychological consequences. There is intense burden on the healthcare workers also. So that all these healthcare workers all are the frontline workers who directly get in contact with the people who are having the COVID positive. So they have to work continuously for day and night, sometimes for many days, and they face a lot of stress and anxiety themselves. And there is a lot of loss of job and layoffs or postponement of exams and loss in business. So, like I said, it is across the age groups and across the categories of people or working professionals that it has an impact. And now, like that, we have realized that many things can happen online, and most of the things can be done from home, and you need not go to the office also. It has both positives and negatives anyways. In terms of the social and economical, there is mass unemployment and depleted social safety nets, and there is starvation, increase in gender-based violence. People are leaving the cities, and then they're going back, and many people are homeless, and people are not able to pay loans, and they are just slipping into poverty. So in one of the survey by Indian Society of Labour and Economics, it shows that loss of unemployment is the immediate impact of the COVID, whereas the lower economic growth and rise in inequality are the long-term impacts. So most of the jobs affected are those who are self-employed. So this is not based on our Indian study, but this is a study from the other countries, which shows that like most of the people who lost their jobs are self-employed, and most of them lost in the urban setting. It is more compared to the rural setting. And lower income people, they report higher rates of major negative mental health impacts compared to higher income people, because they generally don't have savings, and then that becomes difficult to manage for so many months together. So lack of adequate systems and manpower to cater to the mental health needs of the population. That number of psychiatrists or or clinical psychologists or social workers that are available for the population of such magnitude, that it is very, very insufficient, and also the number of doctors are also insufficient now, given that they have to take turns and then do the COVID duties. It is becoming that inadequate to cater to such a large population. So with respect to psychological response to the COVID, most often what is reported is that uncertainties, like whenever there is something which is sudden, that it's an emergency where people are not prepared. So uncertainties always causes difficulties. Nobody knows what is going to happen. So from March till now, like there are so many things that are not they don't have very specific or certain answers. Like say, for example, initially people had this uncertainty about the exams itself, whether the exams will happen, when will it happen, and what will happen to the next standard or course and things like that, or what if somebody gets positive, what will happen, and what may be the treatment, whether people get cured. So some of the questions are over the time it has been answered, and some questions still are there. So uncertainties with respect to various the areas of life, academics, job, finances, health, all this has contributed to experiencing stress. So whenever you don't know something, you feel stressed. Okay. So it has resulted in disruption in day-to-day activities because of the sudden change in the lifestyle itself. And many people are reporting moderate to severe anxiety and depressive symptoms. So this is the common symptoms that is seen in people. That people generally, when there is a stress, the first response is anxiety and the depression. So isolation has resulted in loneliness, depression, and suicidal ideation in many people. Like say, for example, the healthcare workers who are isolated after their duties. Say they work for 1 week and after that they are in quarantine, and then they have to get tested, and then they have to get back to the work, something like that. So like that isolation in healthcare workers as well as in students. Many students are stuck in one place in their hostels. They are not able to travel. So I think they had this difficulty for almost till this month or so. Like they are not able to go back at all. So they were like if one person gets tested in their floor, the whole floor will be closed. It's like that. So that loneliness and depression, that it has resulted in depression and suicidal ideation, because without any human interaction, without any physical activity, and without having a fixed schedule, it is very, very difficult to keep oneself engaged in a small room, confined to a small room. So that is the reason why people in isolation experienced a lot of the mental health issues. And people who got in touch with somebody who has positive, or like people just they have to go to the offices, they have this constant fear of getting infected, and worry and apprehension is something which is, even if you go and shop something, you have a doubt whether that somebody around there had positive, or whether you contracted it, whether that you sanitized yourself well or no. So this worry and apprehension is something which is bothering most of the people. Okay. And people who are healthcare workers, they worry about their own health as well as the health of the loved ones. They are worried basically. So many people who are the frontline workers got infected, and many of them died also. So that how many people have got infected in India, healthcare workers. If you go to the Ministry of Health and Family Welfare, you will get details of all these things. So some people are able to adapt and cope well, whereas some people use all maladaptive coping methods, resulting in much more difficulty. Say, for example, substance use or behavioral addictions, or that attempting or injuring self, or attempting suicides. So about 47% reported that negative mental health, due to the COVID. This is in the general population. And about 30% of them who lost their jobs, their family experienced stress. And generally, like I said, people with low income families, they experienced more stress. And people like that front line workers, like they are experiencing burnout because they are not having any break at all. So they are just doing the work. They are getting the duties and then quarantine one after the other. So that actually puts a lot of pressure on them because they are not able to take care of themselves, and also they are not able to take care of the family. Okay. Substance abuse, I don't know, like how many of you have read, what happened during the March, April, May till all those liquor shops were closed, in India and in the Karnataka also. So many people had withdrawal symptoms, and most of them, that we have a helpline. So the most of the calls were from people who had difficulty, that they had withdrawal symptoms and they were not able to tolerate those, and those are the people who used to call. And people who are stressed also got into taking more substances. So the substance abuse basically increased during this time. Those with chronic mental health problems, they got affected much more because they were not able to consult doctors and OPDs were closed. Only the COVID, the designated hospitals were functioning. Other, hospitals were not taking other, cases, people with other medical as well as mental health conditions. So they did not know how to contact the doctors because there were no transport. In the beginning, at least for about 3 months, that was the difficulty that people faced. And people stopped medication, they could not get medication, so there was increase in the symptoms, and people were not admitted even if they had severe symptoms. So people who were already having mental health problems faced a lot of difficulty. And at-risk population, like I said, frontline medical workers and young people, that children and students and people with disabilities, women, and workers in unorganized sectors, like say contract jobs or part-time jobs, or working as cleaning staff and that helping staff, the housemaids. All these people had difficulty because they were not paid. That they suddenly lost jobs, and then they didn't know what to do. And some people were stuck in some places, like say for example, if they are working abroad and they are not able to come back, so they faced a lot of difficulty. Similarly, elderly also, they are facing a lot of difficulties because again the social interaction is one of the main reasons. Apart from that, their healthcare needs or that family coming and helping them, that was not happening. That their children were stuck in some place and they were in some other place. So people were not able to actually get the help that they require. So another thing that happened is that increase in family and marital problems. Many, the courts were not functioning and people were not able to get divorce, or because of the constant staying at home, people who already had marital problems, it increased. So there were no psychological services that were available. That online therapy services are just picking up, but then many of them are not comfortable actually, that to get help over the telephone, because it becomes difficult if you are actually working with two people at a time, that family, or marital counseling. Okay. So violence against children and women, it has increased substantially during this time. Pregnant women, that they are the ones who are again one of the most worried and the stressed group, because they are not sure whether that it's safe to go and get examinations done, or that what will be the risk of unborn child, and worries about contracting infection to the child also, and concerns about the future. What will happen if the child gets positive, and that what may be the consequences that they have to face. So as it is generally people who are
pregnant and after the childbirth, postpartum, people experience depression. This is something which is a known thing. Otherwise also, during this time, because of the increased stress, many more people are depressed and anxious. So they experience a lot of difficulty in sleeping and anxious about infection control procedures in the family, and that even when they are admitted in the hospital, that family members are not able to visit because they are not allowed. So all these difficulties that they faced, and they could not get many things that generally would happen, say for example functions and other things, that they are not able to, the friends are not able to come and visit them. And I have seen many patients who had childbirth, but then they were not able to get the mother or the in-laws to help them out in taking care of the baby. So only the husband and wife, they have to manage the baby and everything. So with the fear of contracting the corona, so they are very, very worried if they have to take the infant for any kind of vaccination. So most of the people's lives have changed, and it has become much more stressful. So coming to the students, like otherwise also the student population is something which is a distressed a population, because of the lot of demands that are there on them with respect to academics, with respect to their interpersonal relationships, with respect to their intimate relationships and all that. So they experience a lot of stress. But now that the uncertainty of the exams and say their the award, generally they enjoy attending their degree and award ceremony and all that. Those are not happening basically. And then many of them have applied for foreign universities, scholarships and things like that, but then like everything is halted now, so they are not sure as to what is going to happen to all those things, and what if they don't. And people who have completed their degrees, they know that they are not able to get the jobs, and people who are having online learning formats, generally what is observed is that motivation to attend the classes is something which is compromised, and there is increased pressure to learn independently. People who are doing their 12th, there is a lot of pressure to learn independently because they have to perform well in their entrance exams and things like that. But then it is not the same, the teaching experience is not the same. And they experience a lot of disruption in the daily routines. Their waking and sleeping times have changed, and then that because the regularity that is maintained because of attending school or college itself is not there now. So that has disrupted their functioning. And there are higher rates of dropout. They are not able to focus on the classes, online classes, and many people are not listening. You can't just know that without having that eye contact and that people being there in front of you, it becomes difficult to focus for a long time. So approximately about 25% of the one of the studies which reports that they reported experiencing anxiety symptoms. This is the student sample. And people who had, or the students who had pre-existing mental conditions, it has worsened basically. So they are unable to access mental health. This is one of the major hurdles that the students who do not have the financial independence, they always have difficulty in actually accessing the mental health facilities. And now all the more difficult because that they don't know basically where to approach and what to do and all that. And in addition, they are not getting support from the peers also, which otherwise they get it from the school or college. And that sometimes without knowing whom are you talking to and all that, it becomes difficult for the young person to trust somebody. So this is also one of the hurdle why people don't actually seek help. So school routines becomes very important for at least for some special children also, like young children. It is important for everybody, but then it's all the more important for very young children with special educational needs, like say for example children with autism or children with ADHD. They become frustrated and short-tempered when their daily routines are disrupted. So keeping them at home and that managing them becomes very, very difficult, because they need something to be engaged in. That without that, for the family members also it is difficult, and for those young children also it is difficult. And when they go to school, they learn a lot of developmental skills, but then those skills are also that they are missing all those learning that can happen. So students who are in their abusive homes, in the sense that if there is a family discord within the family, which is which they are able to avoid for some time if they go to school or college, but then now they are at home all the time, and then in the environment where there is constant conflicts and fights and things like that, which increases the stress. Gap in learning, that this, even if the colleges are going to get started soon, what is going to happen is that people who are well motivated or self-learner, maybe that they are able to catch up very quickly within the short time that is there now. But then, that people who are not very, who depend on teaching and all those things, and who learn from, majorly from the classroom teaching, they may get affected. That is one. And it's not that all colleges has uniformity in terms of online classes. Some colleges have, some colleges don't have, and know that some schools have like that. Some people have access and some people don't have access. So all this actually increases the gap in learning. And in one of the studies that we conducted in Greece, it is just to say that what percentage of the students may have anxiety, depression and all that. So about 42% of them, it's self-reported, reported anxiety, and a large percentage of them, that is 74%, reported depression and then increase in suicidal ideation. While the quantity of sleep has increased, all of you maybe know that you also follow this pattern that you sleep longer now. So quantity of sleep has increased, but then the quality of sleep has worsened, and then the quality of life of the students have worsened. So feelings of depression, anxiety and burden, this is with respect to the frontline workers. When you think of the frontline workers, I think the major chunk will be the nurses and women. Women are the healthcare providers. The large number of them are women. It can be nurses or it can be ASHA workers, or all these people are at higher risk, and because they are directly involved in treating the patient, COVID-19 patients. So healthcare professionals are also prone to experiencing burnout, and risk of suicide is very high in this population. You would have heard some reports of suicides also among healthcare workers. And know that households with healthcare workers also worry and stress over the coronavirus. They are also worried because they are scared that this person who goes and works in the COVID hospital may bring in the infection also. So and another thing which actually adds their worry is that there are no clear guidelines for treatment. That adds to stress because it keeps changing also. So this is something which has added to their stress. And long periods, this is something which I've discussed earlier itself, that long periods of quarantine, long working hours, and inadequate access to food. When they are in PPE, when they are wearing PPE, they are not able to drink or eat for, say, straight for 6 hours or something like that. So that causes a lot of fatigue and health-related issues also. And they are separated from their families, and because they have to live in the hostel or whatever facility that is provided to them, and they also don't want to infect the family members, so that is why they quarantine themselves. That is very, very stressful, especially when women have children to take care and that at home and there is no help. It becomes very, very difficult to manage these quarantine periods. In addition, there is stigma and social isolation, violence against doctors. So they are doing their best, but then that they are getting treated very, very unfairly also. So this also causes a lot of burden on them. And it is expected that many of them, because they work under stressful conditions, that they suffer depression, anxiety, and distress, and insomnia. Insomnia is another problem that they experience. And like the tele helpline that we have in NIMANS, we have seen a number of doctors or healthcare workers calling the helpline because of these, the stress that they experience also. So overall, you can see that the doctors or the healthcare workers, they have managed the crisis very well within the resources that is there. Okay? But then they need good nutrition, sleep, and proper hygiene, good relaxation, which is very, very necessary. And support from the family and colleagues would help them to overcome the stress. They need constant monitoring. They may not know that many people who work in the hospitals, they may not know that they are having the mental health related issues or the problems, and that requires help also. So constant monitoring of these people is something which is very important. Listening to their anxieties, somebody who can support them, ensure that adequate protection and training how to work in these hospitals, and the extending care to their families are very, very, that these are the ways how we can help the health professionals who are helping others. In a number of countries, like the domestic violence, like I mentioned earlier, it has increased across the world. And when it is combined with the economic and social stress and the movement restrictions, like now that they don't have money, so gender-based violence is something which is increased. And also it is not only that, but then women, a lot of demands are placed on them with respect to taking care of the family, as well as taking care of their jobs, taking care of the sick and elderly, and if they have children at home, so they have to take care of them. So it's from multiple directions they are stressed. So the child care support is particularly, it's difficult now that the say Montessori or say the daycare centers or the creche, like all that is closed, so they don't have help with respect to taking care of small kids at home. So that is a major stress. Okay, so yeah, this I think the other points I've already discussed. Migrant workers are more prone to abuse and exploitation and insecure in terms of their jobs, and mostly that women have this difficulty majorly of not getting time for themselves. Sometimes they don't even like think of the time, but even when they want to take time, there is no time. So that is how it becomes difficult for them to maintain their own mental health. So coming to what are the things that can be done to maintain mental health or well-being? Okay. So first of all, one has to identify whether somebody is experiencing stress. So in terms of the stress manifests in terms of physical symptoms, psychological symptoms, cognitive symptoms, and behavioral symptoms. So physical symptoms can include chest tightness, palpitations, breathing difficulty, basically anxiety symptoms, or aches and pains and change in sleep patterns. All these are examples of physical symptoms. Psychologically, one may feel restless, inability to relax, or feeling the feeling of restlessness in the mind, and anxiety, sadness, anger, boredom, loneliness, death wishes. Psychologically, cognitively, they may have difficulty to concentrate. They may have a lot of negative thoughts and hopelessness, worthlessness, all these things. Behaviorally, people can do either adaptive coping or maladaptive coping. So adaptive will be, say, for example, getting support from family, or negotiating work, or involving in hobbies, or taking time off. So these are all the adaptive, whichever helps. Wherein the maladaptive coping strategies would include use of alcohol, tobacco, or drugs, or isolating oneself, withdrawing, spending time, lot of time on social media, internet gaming. So all these are going to cause more difficulties.
So taking care of the mental health, that is self-management. What do you do? Like, that some of the steps that can be, I think all this information is available everywhere, but then when it comes to following, we don't follow it. So that is something which needs to be taken into consideration, that we have to follow these things. Okay? So the first and foremost important thing is to keep ourselves informed. That is, know the information from authentic sources. Don't just get carried away by rumors, or that exaggerated news sometimes in news channels. So unnecessarily don't get panic because of those things. Read from authentic sources, like say Minister of Health and Family Welfare, or from WHO, or from Center for Disease Control, so CDC. So from there you can actually access the information, or ICMR. So all these websites will give you correct information. So have a routine, that is very, very important. That eating, sleeping, and involving in hobbies, interaction with people, exercise. So you should do all these things on time, even though slightly maybe little delayed because you are at home, that. But still, you should have a routine with adequate breaks. Limit watching news on COVID and checking for symptoms. Like many people, just keep checking their own body for symptoms, and then they get panicked when they notice some or slight symptom also, and then they want to consult somebody. They get tested multiple times. So there are people who get the COVID test multiple times also. So, and social contact is very, very important. That now you are not able to physically go and meet people, but then you can, meet them over the phone, contact friends, family, and that you discuss whatever difficulties that you have. If you have difficulty, in controlling, your alcohol or drug usage, or that smoking, definitely you need to seek help. And you have to limit the screen time, video games, or that spending a lot of time on social media. So you can schedule the time and stick to it. Okay. So having a routine, actually, it helps to overcome many of the psychological problems. So with children, what can be done? This having a plan and a routine in a day is applicable to all ages and all professions and all that. So with children, plan adequate physical indoor activities, because now they are not able to go out and play. So and involve them in household activities, and small things that they can do, or maybe you can put them onto some hobby classes, something like that. Help them to involve in hobbies, and that whenever you notice that there is some abuse that is or some thing which you feel that it is serious, which needs to be reported, you can always call the child helplines to get help to such kind of children, and talk to children about the COVID, so that they follow the safety measures and all that. So that is the reason why they have to be educated, but then they should not be scared, that you should not unnecessarily make them scared also. That is also very, very important. With elderly people, elderly and people with special needs, they need more help. Say they need physical assistance because they depend physically on others, and they have a lot of medical care needs and medications and so many things that needs to be arranged for them. So in case if there are elderly people, people around them, or people, the relatives, family members, they have to make sure that all these things are arranged for them. And they have a lot of need for social contact and support. So family support is very, very important. So make sure that you are contacting them, calling them at least once in a day, so that you are in touch with them. Okay? So help them to use technology now that they are not able to you are not able to visit them sometimes. So use technology and be in touch with them. Check for symptoms of distress and depression. Generally, the most frequently seen mental health problem in elderly is depression. So you will have to check for symptoms of depression, whether how is their mood, or whether there is any disturbance in terms of their sleeping and eating patterns and their interest in doing work and all that. So you check for that, and there are elderly helplines. So if they require help, maybe you can call those helplines as well. So if somebody has anxiety symptoms, like that people can use a lot of anxiety reduction techniques. Say deep breathing is one of the techniques which helps. Mindfulness meditation. So you get all these audios online now. So there are websites where you will get a lot of material on mindfulness meditation, briefer to longer. Similarly, relaxation methods, you will get the scripts and audio records of these instructions, and you can practice with that. And often when people are depressed or anxious, they are just not able to be flexible and think solutions for their problems. So uh, thinking flexibly becomes very, very important at this point in time where when you are actually feeling anxious. So you should not be taking decisions based on your anxiety. You'll have to give time for yourself to, if you are not able to figure out, maybe like discussing with somebody would help you to look at other options that are available also. So not to isolate completely and feel bored and depressed and all that. Uh, Things have to become normal. So it is better to know that start those normal routine activities of going out, maybe with precautions that are necessary. With all those necessary precautions, you can go ahead and do your routine work, and don't lock yourself because that you feel so anxious and worried and all that. Okay, because things have to become normal, and the people have to develop that resistance to any virus for that matter. Okay, so clarify doubts if you have doubts or worries about any of your symptoms or about the COVID itself, and not to know that act on your anxious thoughts. That is very important. So this, because of this anxiety and panic, you would have heard many people that they just got positive and they killed themselves because of that extreme anxiety and thinking of the worst possible thing that can happen. So that like the number of the mortality is very less compared to other uh, such kind of the virus infections and other illnesses. So it is less than 2%, as of now in India. It is less comparatively compared to other diseases also, other infections also. So people like just panic, and many people who are admitted because of the positive, they are improving, but then because of the anxiety, they commit suicide. So in hospitals, things have happened like that. Outside also things have happened. So that is why it is anxiety and panic is dangerous. So that is why you should not take decisions when you are feeling anxious. So when you are feeling sad and lonely, that the best medicine is to make yourself active when you are feeling sad. That is one of the important strategies. In addition, staying connected with others and family members and friends, and when you are sitting and worrying about something, you will not see any other solution apart from the way you think. Maybe you see that only one solution is there, but then there is no way that how that said solution can be implemented. So there is no option at all. So people, when they are depressed, they can't see a lot of options that they have. So it's better to discuss with people, that you will get some of the advices or tips to handle the problems. Engage in activities that gives happiness. This is the most important thing. So say grooming or eating well, painting, singing, dancing, whatever gives you happiness, you involve in those activities. Be kind on yourself. This is very important. People, when they are depressed, they become very, very critical of themselves. They criticize. Okay, so they find only faults with themselves. They don't see any positive things. So that is because of the mood. So you should not believe that because you are thinking like that, you are that. Okay, so because once you are out of that mood, you will not think like that. But then when you are in the depressed mood, you tend to believe and take action because it says something to you and you believe that that is true. It is not true. Okay, so you will have to allow that time to pass, and that you have to think of all the things that are positive in your life, and increase that positivity and hopefulness. That is very important. So identifying one's strengths and resources, and that is very important, and not to get carried away by the thoughts is also another important thing. So if you have suicidal thoughts, like share it with people whom you trust, whom you're close to, who can help you. Or if you find that nobody is there, like who can help the kind of the difficulty that you're going through, it is always better to contact helplines. Now that most of the psychiatry hospitals, many of the therapists who are practicing privately also, they are doing online consultations. So there are that telepsychiatry help is there. And of course, the NIMANS also has, and Ministry of Health and Family Welfare also has. Karnataka government also has. So helplines are there. So do not neglect. So you will have to contact immediately when you have the frequent suicidal thoughts. So it's not rare that people get these thoughts. Many people get these thoughts. Okay. At workplace, it is important to take steps to enhance well-being of employees, like whoever is in charge, or like who are the managers and who are in the higher ranks. They have to make sure that they also pay attention to the well-being of the employees. And the monitoring of the staff is very important, like how their mental health is, and arranging certain kinds of workshops for them to reduce stress. Say, for example, mindfulness workshops are found to be helpful. So try and arrange certain programs wherein they are able to identify if they are undergoing any kind of mental health problems, and then they are able to seek help. So many people are able to manage that work from home, but then for a set of people, a percentage of people are finding it difficult to actually work from home, especially when they are supposed to be balancing the household work as well as the work related to their organization. So it becomes difficult, and sometimes if the houses are small, then it becomes that crowded houses, it becomes difficult to focus and work also. So having a routine here and taking breaks for themselves and negotiating the household work, and sharing the responsibilities, all these things would help them to manage their work better. So that show empathy if somebody is actually having difficulty, try to understand their family context and give them appropriate accommodations if they need some accommodations in terms of the work, in terms of the timings, and other things based on the nature of the family context. Recognize the distress and try to understand the factors causing stress and facilitate seeking help. Like somebody, like I said, having small children at home and having to take care of the whole thing and all that. So understand the context so that you will be able to help them better. Encourage online training, engaging in training courses also. Now, that people are focusing on getting trained and learning new skills and all those things. So this will be of help. So people who have say conflicts, there is marital discord, and then because of the now that lockdown and all that, or work from home, staying a lot of spending a lot of time with the spouse, the conflicts may increase. Okay. So in that case, what can be done as an individual? Maybe you can see that you minimize the together time, and see that what are the things that would increase the conflict. Don't do those things. So as much as possible, not to bring in those kind of issues, or not to continue those kind of discussions, even if it comes. Okay, and know that till you get help to resolve those problems. Okay? If there is violence, abuse, or conflict, refer them to the helplines for women. Psychological help, individual and family therapy are available, so you can actually refer them. Those with infants and pregnant women, follow the safety measures, consult your doctor if there are symptoms of COVID, and not to panic. It is curable. So that is something which needs to be kept in mind.
So I'm emphasizing this again, that for addressing stigma, it is important that you have to be resourceful. That get prepared with the sources of information. You should be knowing, that all the information about COVID, the helplines, hospitals, and the travel pass. So being resourceful helps you to be a little more confident and not to panic when there is a problem. Okay. Use information from authentic sources. Support healthcare workers. Do not discriminate. If some neighbor is tested positive, do not discriminate or do not show that you are scared or you are do not call them names or that a victim or something like that or that case and things like that. Okay. So do not stigmatize people who get COVID. Educate people about COVID and address the myths. That is the most important thing. Now that it has become so prevalent that in most organizations, many people are getting affected. But then I'm seeing in our own hospital, many people are getting, that COVID tested positive, and then that it goes off. You just be in quarantine and you take treatment, it just goes off. So not to get very scared when you are fearful. Then it manifests in terms of your stigma, you stigmatize people as well. So finally, what is important is that it is critical time for everybody, but it will pass. One needs to accept and and to do what is required to cope better is something which needs to be kept in mind. Be responsible, be responsible in terms of following the safety measures, in terms of maintaining distance, in terms of handling your own household work and all that. Be responsible, take responsibility. Because as students, I'm just talking about students now, it can apply to anybody else, that you are only, if you are only worried about yourself and not helping your family, to take care of the daily routine chores and all that, they also feel burdened. So make sure that you also take up some responsibilities. Help others who are in need and take care of yourself and your family. Make use of the time in doing things what you wanted to do. Now that you may have some extra time, please do things which otherwise you may not be able to do. Okay, so maybe picking up some hobbies or completing a course and things like that, which can be done easily now. Have a positive outlook. This is very important, because many things this kind of situations will come again and again. You would have heard about the floods in Kerala, in North Karnataka and all that. So that people periodically face these kind of difficulties, but then one has to get mentally prepared to face these things and being resilient. That not to get very scared. That does not help you. Just to think of what may be the better way of coping with these things. What are the things that are going to be helpful to you, rather than what are the things which will increase your stress. Okay, so you do all those things, but finally, when you are not able to manage yourself, don't ignore it. So don't delay it. So you'll have to take help. Like I said, now there is no need to physically travel to places to get help. Now you can actually over the phone, tele helplines, you can get help wherever you are. So many people from other states are also that they are calling and availing the help from here. Otherwise, they used to that travel and get admitted and then get help, and then we used to refer them back to their places and ask them to contact people from there itself. Now that is not required. So in a way, it is helpful also. So make sure that you get help. Okay. So resources, it is everywhere. So I don't think that it's a long list of things that are there. That everywhere you can actually get a lot of information on how to take care of children or elderly or the pregnant women, and that where to call for geriatric help or where to call for child help or COVID-related help, where to call, and what are the toll-free. There are toll-free numbers. That there is a central toll-free number, state toll-free number, NIMHANS helpline, and there are so many other, that health as well as mental health. There are a number of helplines, and there are resource materials to help you to practice certain kinds of relaxation methods, like say, and yoga, like brief yoga practices are also there. So the guidelines for yoga practitioners for COVID, there is the whole, it's like a booklet online, it is available. So there they teach you all simple small that shorter yoga practices that can be done. Okay. So in addition, that the ICMR and that, like I said, the CDC, Center for Disease Control, Government of India also, they have all resource material. So resources, there is no dearth for that. NIMHANS website also gives you a lot of resources. So you just search for those resources and you can actually make use of them, and maybe you can give them to or suggest them to others also. Okay. Yeah. So with this, I thank you. This is a quote by Mahatma Gandhi: "To lose patience is to lose the battle." So I think that is applicable now. That you should not lose patience now. You have to be patient, and things will change in some time. But then, till then, you will have to keep the patience. Yeah, thank you.
Thank you, madam. Thank you for your introspective approach towards mental health and well-being. Now the floor is open for interaction and discussion. Participants are requested to wait for their turn. I request Madam Sujata to take over. Ma'am, please.
Okay. Yeah. Should I take up the questions from the chart?
Connect back to you. Well, I guess that was a really very informative session. And now the floor is open for discussion and interaction with the resource person. I will be taking the questions depending on the relevance of, and if some questions are repeated, well, we might have to skip that kind of questions. So now I request Dr. Manjula to take the first question. As in when I am reading out the name of that person has to immediately switch on their microphone and address their questions to Madam Manjula. Swati, I request Madam Swati to pose her question. Yes, Madam Swati, you can switch on your microphone and address the question, please.
Good morning, ma'am.
Yes,
morning,
I'm Swati, student of SPR Mahajana First Grade College, Mysore. My question to you is that, how can we students boost our self-motivation to sit for hours, learn online, and do some productive work during this hard time of pandemic?
Okay, so you have been doing that, isn't it?
Yes, ma'am.
So do you have any suggestions on that?
No, ma'am, I'm asking the tips to sit for hours and learn and do some productive work.
You? Basically, what demotivates you?
Distractions in the house and
Yeah, so I think this is like, it is easy to say, but then I think it is difficult to follow. But then if you have a list of things that you want to do, okay, I'm sure that everybody will have a list of things that you are supposed to complete and do all that, isn't it? So in fact, that helps me, like that I have a list of things to do on a daily basis, and I always find that I am not able to complete those things. Okay, so have a list of things that you want to do. Maybe like a mixture of things. Say, for example, academic related. Say, for example, your own personal things. Maybe having a haircut, or so many things that you will have personal things, no, that you want to arrange your cupboard or whatever. So have a list of personal things, have a list of academic things, have a list of social interaction, the kind of activities that you want to do. In addition, if you want to learn something, so in different domains, have a list of things that you want to do over the period of time. Say, for example, a month or a week or something like that, and have that plan for each day. That today that I want to call these people, and know that sometimes I don't find time to call these people. I have a plan that I have to call these people today. Okay, so call people and arrange your things, cook something, and then know that study for some time. So have a mixture of things so that you will not lose interest. If you continue to do one thing for a long time, then you may lose interest. Okay, but then if you are doing different things, but like you are continuing each of those things bits and pieces. Say you will study for 1 hour today, and that, and then you will maybe talk with your friend for another 20 minutes or so, something like that. So mixture of things always would keep that to maintain that motivation, yeah, and interest.
Okay, ma'am. Thank you so much.
Yeah.
Well, the next question is from Gaurika. Gaurika, would you please continue with your question, please?
Yes, ma'am. Ma'am, firstly, thank you for this informative session. And my question to you is, the break from schools and colleges have created a gap in regular routine. All the students have been in leisure. Ma'am, could you give us guidance and tips to give us pressure and so with the pressure that is going to arise when the offline mode of learning starts?
Okay, so you are saying that once now they're relaxed, and once the actual, the physical, that attending school and college starts, they will find it more difficult. Is that the question?
Yes, ma'am. Since we are in a leisure, we all have that tendency to feel pressurized when the offline mode starts. So how could we cope up with that, ma'am?
See, always we have an apprehension of the unknown, isn't it? When if this happens, then how will I cope? But generally, we accommodate and we adjust to situations as and when it comes. So not to worry too much or to be apprehensive is something which is important. When it comes, you naturally do the things. That happens automatically. Okay, like it is a Monday syndrome, or after the vacation we have this stress, that oh my God, I have to go every day, I have to travel, I have to but then one day you go, the next day it will become all right. It's like that. Okay, so we adapt easily. So not to worry, like worrying unnecessarily causes problem, it does not solve the problem. So things will fall in place.
Ma'am, also during this pandemic, a lot of them have lost primary and secondary associatives and have been through a lot of distress and depression, ma'am. So how could one help them overcome this situation?
Yeah, see, many people have lost contact, in terms of their friends, especially the small children who generally don't keep, that calling the friends, or that online thing does not happen with children. They have to physically go and, talk to people, talk to children and all that, their classmates. So they find it a lot of, the pressure or difficulty in facing this kind of a situation. So what can be done is that maybe some activities which can keep them engaged, maybe that I think there are some video based learning programs and all that are there. So you can actually enroll them into those kind of things. Once things become regular, then maybe they will get new friends. Yeah.
Yes, ma'am.
Because certain things that you just cannot do much about it.
Okay, I think Gaurika madam has taken her best effort to answer your question. Now over to Mr. Gautam Bhattacharjee. I would request you to pose your question to the resource person.
Thank you, ma'am. Good afternoon, ma'am. Question is specifically for so there is a section, there is a group of people who were very active before the pandemic, right? They were working, they had a full-time career job, but because of the pandemic, they are currently either out of job, or also we have seen that offers are getting delayed, right? Because of this. What is your message to those people, how to continue with with this, and how to create that positivity and look forward to that things will turn around.
Yeah, I think they have to consider this as a long break, like that people take breaks. Sometimes they take a lot that long leave or something like that, or sometimes like if they want to pursue their own personal hobbies, also they take a break. So I think they have to consider this as a break, that they have got this break, whether they wanted it or no. It is inevitable now that they have to make the best use of this break now. Okay, what is something which they can do in this period? Whether they can do something which is useful for them at the same time, which can give them happiness. Okay, because otherwise there is no other way. Like that you just cannot. Hurry up in doing in getting a job like which is not under your control. So there are certain things which are under your control, and there are a lot of things which are not under your control. I think you will have to just manage the things that are under your control. Okay, so not to focus, because you get distressed when you are actually wanting to control things that are not under your control. Many things are not under our control now. Okay, so that circle, small circle, within that we have to function. See that you function within that, and see what are the things that within that you can do a lot of things. Okay, so take charge of that, not to feel that you are out of control. Okay, you should always feel that you are in control of things. Yeah.
Right, ma'am. Thanks.
Thank you, Mr. Gautam. We have with us now Kavana. Kavana, would you please pose your question?
Good afternoon, ma'am.
Good afternoon.
Since the pandemic, children who have started to go to school, they have been staying back at home, and they don't have much of social. They don't have much to talk. They can't talk to their friends. They, as you said previously, that they can't interact with people online, and they have to go to school to have a social interaction. My question is, how does this affect their mental development? How does this affect the development of children around that age? Since it is very vital for them to interact with people to have a normal
So definitely
social interaction. Yes,
it will have some impact, but I don't think like it cannot, that it can be overcome also. Like once they go back, I think the things will become normalized. So there is a little bit of setback now, but then I don't think that will cause a lot of what do you say, damage or things like that. So I think they will be able to pick up. Yeah.
So the next question is from Dia. Dia, would you like to go ahead with your question, please? Dia? Or shall I help you reading the question for ma'am? Well, ma'am, I take the opportunity to read the question for you sent by her in the chat box. Being productive every day is important for one's mental well-being. And is it really necessary to be productive every day? Very sensible question.
Not at all. It is not necessary. You should not force yourself to be productive all the time. You have all the rights to take a break, relax, and know that everybody has this right. People actually who have this perfectionism, they are the ones who feel guilty of wasting time and spending time and all for themselves. So that is not good for your health or mental health also. So you should enjoy not doing anything also sometimes. Okay, so it is okay not to be productive sometimes. Okay, so not to be very very critical of yourself when you are not engaged or doing things productively. Okay, yeah.
Yeah, as you rightly said, I think, ma'am, in the course of life, we people forget to be kind on ourselves. So I think we need to incorporate that to a great extent in our day-to-day life, to be kind to ourselves.
Yeah.
Madam, the next question is by Darshana Ravindran. Over to you, Darshana. Please go ahead with your question.
Good afternoon, ma'am. Ma'am,
Yeah.
actually, my question was, in such a pandemic, obviously, a lot of us keep struggling with the negative aspects of it. But would there be a positive aspect, or would there be at least like a pair of positive aspects to this pandemic that we have to really focus on? Like, there is something positive coming out of this, and we have to really focus upon something like that. So, is there something that is very important as of such?
Definitely, I think like any adverse situation is a opportunity to learn. I think people have learned a lot of things, isn't it? So, with respect to hygiene or that keeping one's hands clean and then not spitting the roads, some small things like that. Okay, so there are a lot of positives, because of the pandemic, and also like the people are. Able to relax, like they are able to sit and see what they were doing all these days. Maybe that they were running all the time, and they were busy, and they had not observed many things that are happening at home with the children. They didn't have time to observe their children also, so they are spending time with the children. So that is another important thing. So there are a lot of, and the environment also got an opportunity to clean itself for some time, and know that all that pollution came down. So there are a lot of that positives in that. So I think like in any adversity, if you are able to make meaning, then you will not have that you will not feel that there is no purpose or there is no meaning in it, or that the purposelessness will not be there. Okay, so I think that making sense of the things, and that seeing positive things in each and every situation is also very important. So I think now, like that gap or the space that is being given to you, you will have to make use of that to make a good use of that. So those are all the positive things, and many people are able to pursue hobbies, and another important thing is that people are able to cut costs. Like they are realizing how much they were wasting money. Okay, so unnecessary shopping, eating outside, and that so much of traveling, and all that has come down. Now people are not unnecessarily traveling, and they are not eating outside, so they are cooking. That they are actually realizing the benefits of that home cooked food and all that. Yeah.
Thank you, ma'am.
Well, the next question is by Chandana Gowda. Chandana, please go ahead with your question.
Yeah, good afternoon, ma'am. I think mental health of the whole population is more affected than the physical health. Like first, there were no beds for patients in the COVID centers, and now yesterday when I saw the news, they were like they're closing the centers because no patients are coming up. Like due to economic losses, they are closing it. So I think, are we overreacting to coronavirus? Like first, everyone were like. Coronavirus is more effective, and now they are least bothered. They don't even
created by some of the measures that were taken, and that some of the information that the people got, there was no clarity in the information, there was no clarity as to what is going to happen, and that how dangerous it is, or how how it is not so dangerous. And people did not know. When somebody does not know, that is when people panic. And in addition, if the media is giving a lot of information on how dangerous it is, or that making people panic, so many that not very correct information, if it is given regularly, people get unnecessarily panicked. So that was the reaction, and I think that is the reason why many people are suffering that mental health related problems rather than physical health related. So that the mortality rate is less, and then maybe maybe that over the time, with more information, the panic is come down. But then the consequence of this long term changes that have happened, that is something which is taking toll on the mental health of the people. Say that job loss and other things, those are the things which are actually making people worry. Then the corona infection itself. Okay, so now that people know that it is, other things are much more important than this now. This is much less dangerous than they understood. Yeah.
Yes, thank you.
Well, thank you, Chandana. Over to Deepika. Probably this is going to be the second last question, because the organizers also happen to have one question from our end. So over to you, Deepika. Would you please pose your question?
Good afternoon, ma'am. My question was, we usually, the most affected people during this pandemic are how the society quotes them to be the underprivileged. So when we think about them, they do not have access to laptop or internet. But we always tend to, just miss out them and not consider them. So this makes them feel a little insecure and left out, because they are not getting the same opportunity as the others. So their mental health is affected very badly, and due to which they might have too much of negative thinking in them. So how do we reach out to them and make them feel that they're not that vulnerable, and we are there to support them? Because I think at this time, supporting them is one of the main things which we have to do, but not many are doing. So how do we spread this awareness, and how do we help them out?
I think, Deepika, I missed the first part of that. I think initial, which group are you referring to?
Ma'am, the underprivileged, the ones who have no access.
Yeah. See, that is a lot of NGOs and other, the government organizations also reaching out to them, initially with say the food helplines, and then they're arranging their accommodation. People who are the migrant workers, they got affected a lot, and that at various levels, say taluk to gram panchayat, all those. I think villages did not have this kind of difficulty, but then mostly the cities had a lot of difficulty with respect to those people. So I think that educating them about the availability of help itself becomes the primary duty of whoever wants to help them. Okay, because I think we used to get a lot of calls initially when we started the tele helpline, that from the migrant workers and how they are stuck, and then putting them to the respective facility, say transport, or whoever is taking charge of the food helpline. So many things within the state, within the town, so that becomes important. Okay, all of them have phones basically, even if they don't have nowadays the internet connection is also not very costly. People get that very easily. So that just telling them that these are the things that they have to look at, and then which number they can call. They wanted blood bank numbers, and somebody wanted how to reach the hospital, whom should we contact, like that. So basically helping them through whatever the means that is available is very important. I think the telephone is something which is available with the mobiles, are available with everybody. Contacting them through that becomes very important. Yeah. So that way, helplines plays a very, very important help now.
Okay, ma'am. Thank you, ma'am.
Well, thank you very much for your questions, delegates. We really appreciate your effort. Well, there is one more question by Madam Surya from Chennai. Madam Surya, over to you. Kindly pose your question.
Yes, ma'am. I'm currently pursuing Masters in Counseling Psychology. So my question is, while a lot of positive outcomes like being with the family of late, spending a lot of time at home, taking up lessons and assignments, even conducting workshops and attending workshops from the comfort of our homes, and a vast cost cutting, the expenditure has really gone down, I should say, like going to shops and all those things, and no more pollution, no traffic congestion. So while all these are the optimistic aspects of corona pandemic, as I find it as blessings in disguise, why not like so is it all right for us psychologists to focus on more of health and positive psychology instead of inducing fear and distress among the people? So it would be of preventive health psychology care, right?
Definitely, that is a good point. Actually, that always any psychological help will have the positive aspects. It is not that we are only like looking at the symptoms and only addressing that. Always that prevention and promotion is a part of your intervention. So I think this is having hope and that improving well-being and happiness. All those things are very very important now. Yeah, so you are right.
Yes, ma'am. Yes.
Well, there is one more. Madam, can you hear me?
Yeah.
Yeah, there's one more question from Madam Meera from Delhi. Over here, she would like to know as to what kind of measures that she can take to handle anxious students, in her college. She happens to be an assistant professor from education department.
That the context is the same for everybody, and whatever happens to others will happen to them also. It means that that there is a way to address this problem, and it is just that they should not catastrophize it. So I think that telling them that how the institute or a college is going to take steps to address all these things. It is not only the educational institution, but also the government also has a way of actually that addressing these whatever gaps that has happened. So I think like whatever happens to everybody, it happens to you also. I think one has to take it in that spirit and see that what best I can do instead of worrying about what is going to happen. So that is the most important thing. So that worries, one should not know that as much as possible not to engage in worries, or not to give importance to the worries. Like it will come automatically, but not to give importance to the worries, and that just to distract themselves, postpone those worries are very important.
Thank you, ma'am. All right. So that was a very, very interactive, discussion that happened with the resource person. Ma'am, one final question from the organizers. I hope you would oblige. Ma'am, being an academician, I have observed a kind of transition that has taken place even within our educational system in the new normal. I think most of the concepts or most of the factors that we used to focus during our classes or whatever are now to be modified and changed, keeping the new normal in mind. So I would want few suggestions from you for our students, as to what kind of aspects associated with new courses, keeping the new normal in mind, or new kind of approach in our methodology. Okay, what kind of things can be incorporated? Let me tell you, we have a counseling center, but I don't think that is just enough. So in terms of new form of activities or improvement in the kind of courses that we should introduce from now on, in the background of this purview of mental health well-being, could you please suggest me few?
So do you have these the option of introducing new courses and all that?
Of course, ma'am, of course, because we are
Okay.
an autonomous college.
Uh-huh. So what kind of courses do you have now?
Uh,
Short
right
term.
now, right now, it is a combination of criminology, forensic science, psychology, and sociology, ma'am. But however, within psychology, we were emphasizing more on clinical psychology, health psychology, positive psychology, and counseling psychology. But within this content, what kind of aspects can be included to enhance the worthwhileness of these kind of courses to today's use?
I think it is more of application oriented, the courses. It's something which has to be incorporated because I think now, like if you keep the national education policy in mind also, that they think of the application, increasing the application of these courses, and know that I think more practice based and hands on kinds of training, and that skill based training courses, if you can have, even if it is shorter, with the practical utility of the master's degree, because master's degree one is supposed to have more skills. I think you can actually focus on that.
Yes, right.
Yeah.
Definitely, ma'am. I'll get back to you on this on a personal note. I think I would get more, important information on in this regard. So thank you very much for encouraging all the participants and patiently answering their queries. Now we are heading towards the valedictory. I request all the participants to stay connected.
We now come to the end of the question and answer session. Dear participants, it's a moment of triumph to assert that our endeavor through the webinar has been acknowledged nationwide, with 65 participants representing various states in India. To highlight a few, Meghalaya, Nagaland, Delhi, Tamil Nadu, Karnataka, and Kerala have participated and enabled us to make an event of this magnitude a productively successful one. We appreciate the sportive gesture of all the participants. I now request Madam Sujata to propose vote of thanks. Over to you, ma'am.
It is indeed a great session what we have had within such a short notice period of time. I consider it to be a great pleasure and privilege to thank one and all. Madam Manjula, it was a very informative and insightful session. Our sincere gratitude to you, Madam, for taking time and making this event a successful one, because I know you are a very, very busy and a preoccupied person. I really wonder even now as to how you make it. Probably on that also, I need to take some more tips from you, ma'am. The SBRR Mahajana College and Department of Psychology would love to be associated with you for our future endeavors of this sort. Kindly oblige even then, ma'am. So I am making an advanced request. Thank you very much for your time and for the dedication that you have shown, patiently answering every question, ma'am. I now thank the delegates for being so indulgent, for taking the effort and encouraging us to come up with much more events like this. I also extend my thanks to the technical staff, Mr. Tejaswi, Mr. Mahesh Reddy, Mr. Manjunath Systems Admin Mahajanas, Mr. Ashok. Thank you guys for everything. And how can I forget to thank our principal in charge, Madam Pushpa Rani. Thank you very much for your time. I would also like to extend my heartfelt thanks to our public relations officer, Madam Purnima, who had been through with me all this while, being a great support. Thank you, Purnima. Now, I request Purnima to take over the session with few instructions for feedback and as well also the concluding remarks. Thank you one and all. We are looking forward for your cooperation and support in future as well for this kind of events. Thank you once again.
Thank you, ma'am. I once again thank all the participants wholeheartedly for your active participation in the national level webinar. Please fill in the feedback form. The link will be available only for 45 minutes. E-certificates will be issued to only those who have submitted the form. Thank you one and all. I request once again the participants to turn on the video so that we can take a picture of that. Kindly. All the participants.
Yeah. Well, there is one important instruction to all the participants. Please do not leave the platform. I want everyone to please switch on their video mode for a group picture. We request all the participants to switch on their video mode options at their individual devices. Kindly switch on your video mode options, guys. Delegates, kindly switch on your video mode option, please. We need to have a group picture. I would request everyone to switch on their video mode.